Hi, I'm Dr. Tom Novacheck, Associate Medical Director at Gillette Children's Specialty Healthcare in St. Paul, Minnesota. I want to provide a brief look at our paper published in DMCN about the consistency of problem identification and treatment recommendations amongst the interpreters within our motion lab. The usefulness of a medical test is defined by its reliability, whether it alters decision-making, and whether it results in better outcomes. 3D gait analysis has been shown to change decision-making and improve outcomes. The reliability or consistency, however, has been a topic of controversy. It is interesting to note, however, that the level of agreement for established and accepted orthopedic classifications is similar to those for 3D gait analysis. Despite that, the variability of gait data interpretation is one of the most frequently cited reasons that the utility of gait analysis remains controversial and likely limits its adoption. This article describes the consistency of gait data interpretation for both problem identification and treatment recommendations within our institution amongst our multiple interpreters. Here is the list of 25 common bone, tone, and soft tissue problems. We asked the interpreters to identify it as a problem if he or she thought it was a clinically significant factor compromising gait quality and for which the interpreter might consider surgical intervention. Here is the data collection form. For each side, we chose whether the problem was present, not present, or indeterminate. The list of surgical treatment recommendations included tone reduction, bony correction, and soft tissue management. Here is the data collection tool, and for each we chose whether to recommend the procedure or not for each side. We assessed the percent agreement to evaluate the consistency using an unweighted chance-corrected Fleiss kappa as the primary measure of consistency. We found that the average percent agreement is very high and no single interpreter was different from another. The agreement for bony and soft tissue problems was similar. Excellent agreement and substantial agreement were found for a large number of common problems. In fact, we had a substantial agreement for the 10 most consistently identified problems and moderate agreement for the 10 most frequently identified problems. We found an even higher percentage agreement amongst interpreters for treatment recommendations. Again, no interpreter was significantly different from another. We had substantial agreement for the 4 highest rated items. We found that our interpreters had moderate agreement for the 10 most consistently recommended, frequently recommended, and the 5 most commonly performed procedures at Gillette. This paper shows that a group of experienced physician interpreters of 3D gait data at a single institution have moderate to substantial agreement for many problems and common treatments for both bony and soft tissue problems. This is important for consistent care and is central to establishing the reliability of gait analysis as a tool for clinical decision-making.